forms there if you want to kind of follow along. So I would come in, and I'm going to kind of go through it now just like I was you as a student, okay? So I'm not going to actually do much talking in between here except what I might say to whoever is evaluating me, okay? Okay, hi, can you tell me your full name and your date of birth?
Catherine Joseph, 11/25/88.
Okay, and how are you feeling this morning?
Good.
Good. Any pain or anything?
No.
And you slept okay last night?
Yes.
Okay, I'm just going to go ahead and I'm going to shine this light in your eye. I'm just checking your pupils, so just look straight ahead. Okay, I'm looking for the light response in her pupils. I shone the light in both eyes, and I got a constriction in both the direct and the consensual eye. So I would call that a positive response. I'm going to go ahead and kind of look at her skin color, and I can at this point feel for temperature, and I would want to feel all the way down to feel for warmth, and she's nice and warm. I'm going to notice her breathing, and she seems to be breathing without any effort. She's not struggling to breathe. I'm going to go ahead and listen to your lung sounds. What I want you to do is just breathe just in and out like you normally would. Okay? I'm going to listen to the tracheal sounds. This is actually bronchovesicular sounds here. Nice and clear. Would you sit up for me? And you can actually do this in practicum. She was nice and clear on the front. I would continue to do respiratory assessment by listening to bronchovesicular sounds here and here. Here and here. See, at this point, you don't even really have to have them breathing anymore because I'm not hearing what you're hearing anyway. Okay? I would listen vesicular down here, vesicular down here, laterally, and laterally. And what I would hope to hear is all clear sounds, no adventitious sounds. I'm going to lay back down. Then I'm going to listen to your heart, but the first thing I'm going to listen to is the carotid. So what I want you to do, I'm going to get my bell going. I want you to take in a deep breath and hold it. I hear nothing. Take a deep breath. Hold it. Good. I hear nothing, which is good. I do not want to hear a buoy. Go back to my diaphragm. Now I'm going to listen to your heart sounds so you can just breathe normally. Aortic. S2 more prominent. Pulmonic. S2 more prominent. Herb's point. About equal. S2 just a little more prominent. It's going to be hard for me to hear here because she's got this heavy sweater on. Tricuspid. I really can't tell. Her shirt's too heavy. And then mitral. Again, I don't hear it very well. But S1 should be loudest down here. Okay? Then I'm going to go ahead and palpate for pulses. I'm going to do carotid one at a time. Definitely a 2+. Definitely a 2+. Now I'm going to do the radial at the same time. 2+. I would feel for femoral, and you guys can kind of pass that one for practicum, but they're right in the groin area. I would come down, and I do require you guys to have socks off during practicum, okay? Feel for dorsalis pedis. Pretty hard to feel through her sock. I'm feeling them, but they feel like a 1+ to me. They're probably better once her socks are off. And the posterior tibial. Again, pretty hard to feel through socks. But I do feel them. This one actually feels stronger than this one. Okay? I would also note if she has any edema. Without socks on, that would be much easier. Okay? Then I'm going to go ahead. I'm going to come back to her abdomen. When was your last bowel movement?
Yesterday.
Okay, and you haven't had any trouble with that? And you're urinating okay?
Yes.
Okay. I'm just going to lift this up a little bit. I'm going to listen to your abdomen. I'm auscultating first. Oh, really good bowel sounds. Did you hear those sounds? Better bowel sounds on the right, but she has some on the left. Now I'm going to go ahead and I'm going to just palpate your abdomen. Do you have any tenderness anywhere? Okay, lift up your knees just a little bit. Palpate. Does it hurt anywhere that I'm pushing?
No.
Okay. Good. Okay. Can you grip my hands for me? Squeeze. Okay. And you take and push against, put both legs down, push against my hand. Okay, other side. Okay, and now, do you have any joint pain or anything? Okay, you can get up and just walk for me when you watch your gait. Okay, come on back. Got to push again. Where we go. And that there. And I'm also going to check her capillary refill. Instant return. Instant return. That's a deep hint. Because at this point is where you get to say, I think I'm done. And then I'll say, well, go look at your sheet. Did you forget anything?
So for eyes, is all you have to do is just the light?
All you got to do is look for the constriction. What you would want is that when I shine light in this eye, this one and this one should constrict. When I shine it in this eye, this one and this one should constrict. That's a direct and a consensual light response, which is what you should see. I would like you to know that the direct is shining it in, the constriction that you get when you're shining it in that eye, and consensual is the equivalent response in the other eye.
So you don't have to do accommodation?
You do not have to do accommodation.
Or pupil size?
Usually I will look at pupil size. Yeah, and hers were about a 3 to 4. Yeah, and you might tell me that. Say, you know, pupils are equal, they're about a 4, and she responds to direct and consensual light.
Did you do orientation?
I didn't specifically ask her. I just asked her her name and her date of birth. I could have asked her, and I would like you all to do this, is to say, where are you? Do you know where you're at? And why are you here? That would give you your place in your situation. Okay? Anything else?
And with the sheet, just as long as you cover all of them, it doesn't have to be...
It doesn't have to be in the order that I did it, but it should make sense to you. I mean, I pretty much moved head to toe. The only reason it's hard, I mean, you could do it totally head to toe. But to do that, for instance, if you really did head to toe, you would do orientation and eyes, and then you would move to lungs and heart, and then do carotid and radial, then abdomen, then femoral, then dorsalis. I mean, you'd have, that doesn't make sense to me. For me, I like to check all my pulses at once and then move back up to the abdomen. That's what makes sense to me. And while I'm down here doing pulses, I might as well look for edema. Okay? So you organize it whichever way it makes sense to you, because you're going to do this on every patient that you ever take care of. And you'll come up with the system that works best for you. Okay? And it doesn't have to be my way, as long as you cover everything. Okay? Does it seem hard?
Mm-hmm.